طيب، بسم الله الرحمن الرحيم. الليلة عندنا برضو يوم 28/9. عندنا برضو سيشن بتاع ال SBE. أفتكر بس عشان هناي نكسب الزمن ما يروح في حاجات، مثلا الليلة يكون يعني more efficient. نحاول يعني نخلي الناس أكثر كمية من الناس الليلة يعني تحاول تقدم، و preferably ناس ما قدمت. حنعدي على مثلا الكيس. انا حقرا الفينيت في الاول، الكلينيكال الانفورميشن بتاعتها في الاول، حتى من بعدها مثلا لما نبتدي نفتح الكيس ادي الكيس للزول بعده. آم، ممكن نقرا في الاخر الكلينيكال ايفالويشن، لكن افتكر ذاته الكيس الواحده ممكن الليله كم زول مثلا يجرب فيها. عشان بس شفت شنو يكون في الكيس في فايده. الكيسز اللي عندنا ما كثيره، عشان كده افتكر ذاته في الكيس الواحده مثلا لو الكيس ما مشت كويسه زي المره اللي فاتت ممكن ندي كميه من الفرص للكيس الواحده ذاتها يعني. فدي to be more efficient for timing الليل ان شاء الله. طيب، افتكر بس نعدي على الكيس. افتكر الكيسز اللي فاتت احنا وصلنا لحسن. ايما برضو عملناها المره اللي فاتت، مش كده؟ اخوانا، سوري افتح معاي. It's just me and you.
افتكر ايميلي اللي عملناه قبل كده.
عملناه. طيب، حيكون عندنا الليله تقريبا مايكل اوكويو. مايكل اوكويو من نيجيريا. طيب، قبال ما نبتدي الكيس، منو اللي حيقدم معانا؟ الناس ما قدمت قبال كده. عشان نكسب الزمن، الناس يعني شفتوا، يعني ما في واحد ولا اثنين، في كم واحد حيقدم يعني. بدنا نكون جاهزين واحد ورا واحد، ما نقعد نضيع الزمن الليلة في منو اللي حيقدم ونختار وما نختار منه ما نختار منه. عشان نفتح السيناريو طوالي. زول يتقدم يا جماعة. لا، ده ما هو ما زول يتقدم، ده الزول الأول يتقدم في أكثر من زول الليلة. يعني احنا لو سهلت معاه دايرين الليله اقل شيء 4 5 6 7 كمان لو في طريقه.
يلا يا شباب، ما زول يتقدم. دكتور ياسر قال لكم يعني هننتظر
عشان
لحد 200.
دايرين الاول يعني لانه في كثير الليله، دايرين فرص كثيره يعني للناس كلها.
طيب يا بس انا ممكن ابدا.
انت يا خلف الله كده خلينك اللي عاوزه، مش يعني مقدرينك اي حاجه، لكن دايرين الناس اللي ما قدمت.
لا بدل لي فرصه يا اخي.
بدي اوريك شيء والله، اتحرم الليله ما نرجعك. الليله خلف الله اول
تمام.
زول، الزول الثاني يجهز يا جماعه. كويس. طيب، انا حبتدي
تمام.
حقرا السيناريو في الاول، الكلام في الاول، وبعدين لما اقول لك يا خلاص الله اتفضل حيكون عندك 7 دقائق. ال7 دقائق تو بي فوكس بتاعت الانترفيو. في حاجه بس يعني نبه ليها عشان تو بي efficient. الليله في اي انكاونتر، كويس، دائما الليله يعني مثلا الليله قدم روحك. My name is Dr. خلف
اوكي.
الله. I'm the psychiatrist here today. How can I help you? طوال دي اول كلمتين. السلام عليكم وعليكم السلام. لما يقول لك I'm here because I'm having an anxiety, I'm having depression, I'm sorry to hear about that. I'm hearing voices, I'm sorry to hear about that. Can you tell me more? دي أول حاجة. بسم الله الرحمن الرحيم. open ended question وسم validation للهناي للcomplaint ذاتها. قال لك أنا the voices are
اوكي.
bothering me. I'm sorry to hear that the voices are bothering you. Can you tell me more about them? بعدين ممكن حبة تفاصيل. لكن كلمتين بتاع validation ديل ما بضروك في الأول ودي expected. open ended question. اول شيء عارف
اوكي.
بيروحك. My name is Dr. خلف الله. I'm the psychiatrist here today. How can I help you today? What brought you into the clinic? ولا مثلا انت في emergency. What brings you here to the emergency? I'm here because I'm hearing voices. Well, I'm sorry that you're like about this experience. Um, I want to hear more from you so I can see how can I help you.
اوكي.
Tell me more about such an experience. Open ended بعدين تبقى specific.
اوكي.
سامع؟ يلا.
اوكي. تمام.
هنبتدي في مايكل اوكويو. دي الشورت سيناريو هنا. A 33 Michael Okoye is a 33-year-old Nigerian chef attending a follow-up outpatient clinic, psychiatric clinic appointment. He's currently experiencing a relapse of schizophrenia, which his community psychiatry nurse has been trying to manage in the community. A task: take a psychiatric history.
Okay.
Pre-reading psychiatric history taking for a possible schizophrenic relapse. In this simulation, you will be taking the psychiatric history of Michael Okoyo, a 33-year-old Nigerian chef who is currently attending a follow-up outpatient psychiatry clinic appointment. Michael is experiencing a relapse of schizophrenia, which his community psychiatry nurse has been managing in the community. Your task is to gather comprehensive information to understand Michael's current condition and to inform further management. Understanding schizophrenia. Before engaging with the patient, it is crucial to have solid understanding of schizophrenia. Schizophrenia is a chronic and severe mental illness affecting how a person thinks, feels, and behaves. It is characterized by episodes of psychosis, including delusions, hallucinations, disorganized thinking, and other cognitive impairments. Key features to explore: 1. Delusions, false beliefs that are not based on in reality, hallucinations, seeing or hearing things that are not present, disorganized thinking, impaired logical thinking and speech, negative symptoms, a decrease in the ability to function normally, such as lack of motivation, withdrawal, and blunted affect. Communication skills. Effective communication is vital psychiatric history taking. Here are some strategies to consider. Empathy. Show understanding and empathy. Patients with schizophrenia might have heightened sensitivity or may perceive things differently. Clarity. Use simple, clear, and concise language. Non-judgmental attitude. Maintain a supportive and non-judgmental attitude to encourage open communication. Active listening. Demonstrate active listening to validate the patient's experience and feeling. Psychiatric history taking. When taking a psychiatric history from Michael, consider the following component. Presenting complaint. Start by understanding why Michael is attending the clinic today. What are his concerns and symptoms? History of present illness. Explore the onset, duration, and progression of the current episode. Identify any triggers or stressors that might have contributed to the relapse. Past psychiatric history. Review Michael's past episodes, treatment, hospitalizations, and response to medications. This includes understanding his baseline functioning and any residual symptoms. Medication history. Gather information on current medication, adherence to the treatment plan, and any side effects experienced. Substance use. Inquire about the use of alcohol, drugs, and other substances, as this can impact the management of schizophrenia. Personal and social history. Explore Michael's background, including his occupation as a chef, social support, and any significant life events or stressors. Family history. Investigate any family history of psychiatric condition, which can provide insight into genetic predisposition. This simulation aimed to enhance your skills in a psychiatric history taking, focusing on empathy, communication, and thoroughness. Your interaction with Michael should aim to gather comprehensive information to understand his current state and guide further management effectively. جاهز يا خلف الله عشان عندك 7 دقائق to use it effectively just focus interview.
Okay.
Based on your pre-reading, what did you learn?
Okay. How to use communication skills with patient, such as empathy,
Okay. Are there any aspects of this topic you feel confident in?
showing empathy,
Okay. Are there any aspect of this topic you need to continue to develop?
I think comprehensive addressing of symptoms of schizophrenia.
اوكي. بس عشان تكسب الزمن لازم يعني مع كل يعني انت يشو امباثي لكن ما مع كل كومبلين عشان عندك زمن قصير.
Okay. تمام.
alright. يلا بسم الله. Scenario info, Michael Okoyo, a 33-year-old Nigerian chef attending a follow-up of patient psychiatric appointment. He's currently experiencing a relapse of schizophrenia, which his community psychiatry nurse has been trying to manage in the community. Take a psychiatric history.
Hiya, mate. How's it going?
Hi, Mr. Michael.
It's Michael, actually. But yeah, hi. You're from the clinic, right? Are you here to check if I took my meds? Because I told them the voices are louder when I take the tablets, not quieter. I don't like how they make me feel.
Okay. Okay, Michael. I am the doctor in the psychiatrist unit today. How can I help you?
I don't know, doc. People keep telling me I'm supposed to be here. But honestly, I don't trust this place. Sometimes I think you lot are watching me. Or maybe you're all working together. You're not here to put anything in my head, are you? Because I keep feeling this buzzing and I swear someone's trying to mess with me.
Okay, I completely understand your concern, Michael. Could you please tell me more about what you have been feeling recently?
What about how I've been?
What about how you've
want to
been
know?
feeling recently?
Do you mean how I've been feeling lately? Well, honestly, not great. My head's all over the place. Sometimes I hear voices, like proper shouting voices, telling me not to trust anyone. And I get these weird feelings like someone's watching me or planning something. It's hard to focus at work, and I don't really talk to people much anymore.
Okay. Can hear what you are experiencing. I'm sorry to hear that. But I think we will be safe and be safe and assured here.
Sorry, I'm not sure I get what you mean. Are you asking about my work or the voices? I can't really think straight lately. Things get mixed up in my head. Sometimes I just want the noise to stop, but nothing really helps. Can you say it another way?
Okay, Mr. Maki. I'm now in the position to help you make your feeling and thinking better.
I like to feel better, yeah. But every time I try, something messes it up. Like I keep thinking there's something in my head, like a chip or some kind of tracking thing. It keeps buzzing, makes it hard to trust anyone. Even you right now, I just want some peace, man.
Okay, yes, I understand your concern. Could you tell me what are these
Complain about
voices
what exactly?
telling you?
Sorry, I'm not sure what you mean. Complain about what? If you're saying you'll help, then all right, I guess. Just please don't try anything weird. I don't want anyone near my head.
Okay.
All right. Just let me know what you want to ask. I'll try to answer. But please, no tricks, yeah?
Okay. Could you please tell me if there are
Tell you what
any
exactly.
any visual images you can see by yourself and no one else?
Are you asking about the voices? Yeah, I hear them, but nobody else does. They say things about me, sometimes laughing, sometimes warning me. It's like they know stuff I don't. I can't make them stop. It's scary, honestly.
Okay. I completely understand your concern. Okay. What about seeing people or animals?
You mean the people I work with or my family? I don't trust them much lately. Feels like they're in on it or maybe watching me for someone else. I try to avoid them, stay in my room. Even at work, I keep to myself. It's just hard to know who's real these days.
Okay.
Yeah, that's all I got, really. Just tired, you know. Let me know if you need something else.
Okay, Michael. Do you
All right. If you
have,
want to ask,
sorry? What
no worry.
did you say?
No worry. Hear what, if you mean the voices, yeah, I hear them a lot right now too. They keep talking over you, making it hard to listen. If you're asking about something else, can you say it again?
Okay. Michael, do you have any abnormal belief or doubt about people around you?
Yeah, I do. I think some people are trying to plant something in my head, like a chip or device that tracks my thoughts. Sometimes I feel like even strangers on the street are watching me or talking about me. It sounds mad, but it feels real to me.
Okay. And how this make you feel?
You mean, how does it feel? It's like I get this buzzing in my head or a tingling, and I just know something's not right. Feels like people are staring, whispering, even if I can't see them. Makes me want to hide away.
Okay. I understand your symptom. So, what can I
Really? You
help
get
you?
that too? I thought I
Please
would.
tell me.
Hi,
Please
sorry.
tell me what
You
can
want me
I
to
help
tell
you
you
with?
more about what I feel? It's just my head feels crowded. Like there's too much going on. The voices, the buzzing, the fear people are after me. It's exhausting. Sometimes I just want to be left alone.
Okay, and the silent concern. Are there any feeling or experiencing you want to talk about?
I barely watch it now. Sometimes I think messages are hidden in the shows, like they are talking to me or warning me. Makes me uneasy, so I just keep it off most days. Too much noise in my head already.
Okay. Okay, thank you. I will prescribe for you some tablet to take, and you will feel better after that.
All right,
So,
that's fine.
what's your
Just let
opinion?
me know, let me know what you want to talk about next. I'll try to answer best I can.
Okay. Okay, Mr. Michael,
Nothing else.
do you take any substances or medication?
On what? You mean you're worried about me or something specific? Just say it straight, please. My head's a bit muddled today.
Okay, Mr. Michael, do you take substances like alcohol or any drug?
Do you mean my medicine? I stopped taking it a while back. It made me feel weird, slow, and the voices didn't stop. I tried using weed instead, but that just made things different, not better.
Okay. And what about alcohol?
Estimate for what? Sorry, I'm not sure what you mean. Can you explain a bit more?
What about alcohol intake? Do you take alcohol?
At home, I mostly stay in my room. I don't really talk much to my family lately. I just feel safer alone. Less chance for anyone to do something to me. It's lonely, but I don't trust being around people right now.
Okay. Okay, thank you.
All right, then. If you need to know more, just ask. I'll do my best.
Okay. Mr. Michael, do you feel that someone is out to harm you?
I'm not sure what you mean by video key. Are you saying there's a new camera or something watching me? Because honestly, that sort of thing really makes me anxious. I already feel like people are watching me all the time.
Okay. I completely understand your concern.
Sorry, I don't quite get what you mean. Could you say that again, maybe in a different way? My head's a bit fuzzy today.
Okay. Okay, Mr. Michael.
All right. Just let me know if you need.
For how long you have been off of your medication?
No, I haven't talked to my manager much lately. I avoid work people. I can't focus, and I feel like they're judging me or could be in on it. So I just keep quiet and stay out of the way.
Okay. I mean about your medication. For how long you give up taking them?
I haven't updated anyone at work in a while, maybe a few weeks. I just don't feel up to it. Feels like too much, and I'm worried they'll use what I say against me. So I just stay quiet mostly.
Okay. Please be reassured. I am here to see you and treat you. I will try to do some medication just make you feel better.
All right. Next Tuesday, yeah? Okay. I'll try to be here. Thanks for letting me know.
Thank you.
Are you still there?
Yes, yes, I am.
Okay, good. Just let me know if anything changes or if you need me to do something different. I'll try.
So okay. What about the relatives?
Me, I'm just tired, really. Things are confusing and stressful, but I'm managing, sort of. Just hoping things get quieter in my head soon, you know?
Okay, okay.
All right. Thanks for talking with me. See you next Tuesday, yeah?
Okay, there are lots of things I would like to talk to you about it. That in your family. Is there someone in your family that have strange behavior or being mentally ill?
All right. If you want to talk more next time, that's fine. I can try to explain more then. Just hope things are calmer by then.
Okay.
All right. Take care till then. Are you still there?
Yes, sir. Yes, I am. Yes, I am, Michael.
Okay, no problem. If you need anything or want to ask more, just let me know. I'll try my best, even if my head's a bit busy these days. Are you still there?
خلف الله عندك أسئلة ثانية ولا انتهيت؟
Michael, have been accused by someone
Accused? No, not really. Unless you mean people thinking I'm acting strange at work or home. They look at me funny, but no one said I did anything wrong. Just feel like everyone's judging me or talking behind my back.
خلف الله، انت موجود؟
يس، مع اني انقطع
اوكي واصل.
الكوميونيكيشن.
Yeah, maybe.
Mr. Michael.
Yeah, I tried.
Do someone in your family?
It's obvious. Okay, that's fine. Just let me know if you need anything else.
Okay, Mr. Michael. Do you go for your work?
Okay, that's fine. I'll wait to hear from you. I use my old Samsung, but sometimes I feel like even my phone's not safe. Like someone could be listening or tracking me through it. Makes me nervous to use it much. Why?
Okay. Mr. Michael, what about your job? Do you have any recent job you are doing lately?
My job's hard now. I used to enjoy cooking, but lately I can't focus. I mess things up or forget orders. I try to avoid talking to the others in the kitchen. They look at me strange. Sometimes I just want to leave early, but I need the money.
Okay. I'm sorry to hear that. I think your symptom will improve.
Maybe a little, but it doesn't feel much better. My head still feels crowded and I still hear things. Work is still tough.
Okay.
I'd like things to improve more, honestly.
Okay. Mr. Michael, do you feel that someone or agency control your thought?
It's Michael, not Matthew.
Michael, Mr. Michael, do you feel that
Yeah, it's Michael, that's me.
someone
Sorry, if I'm a
is
bit slow today,
controlling your mind?
Sorry, I don't understand. Who's she? What do you mean by your what? Could you say it another way? My head's a bit mixed up today.
Okay, I mean, do you feel that someone is controlling your thinking?
You mean, do I see people watching me? Yeah, sometimes I feel like there are people outside or in the street looking at me, checking if I'm doing something wrong. Sometimes it's just a feeling. Sometimes I think I actually see someone. It makes me really anxious.
Okay. So you prefer to stay alone?
Yeah, I stay alone most of the time. I don't really like being around people now. Feel safer by myself, less chance for anyone to mess with me or watch me too close.
Okay. Yeah, Mr. Nati, do you want to harm anyone of your relative or your friend or your colleague?
No, I don't want to harm anyone. I just want to be left alone, really. Even if I get scared or angry, I just stay away from people. I don't mess with my colleagues. Just keep my head down.
Okay. I think that is good. This is good as good. Please keep it.
All right. If you need me to do something or answer more, just let me know. I'll try my best.
Okay. Mr. Marcus, do you thought about harming yourself?
Okay, what do you want me to start with? Just let me know what you need.
I mean, do you try to have yourself?
Card? I'm not sure which card you mean. Bank card, work card. I haven't really used any lately. Haven't felt up to going out much. Can you explain what you mean?
I mean, having yourself.
alright الكيس قفلت. الكيس دي يعني كانت زي مختلفة من الكيسز الباقية دي، ما 7 دقائق، دي ما فوكس هيستوري، ده كان فول هيستوري 15 minutes، مختلفة من الكيسز الباقية. حسألك أنا يا أخي الفضل directly، أنت what do you think went well, what do you think did not go well?
I think الحاجة going well الcommunication معه. She
Okay.
just spoke me.
Okay. طيب what do you think did not go well?
اللي هو الاسيستنت بتاعي، الاسيستنت ده كان كومبلمنت مع كل حاجه.
طيب
يعني دلوقتي انت كده مع العيال ذاته، يعني انا بعتمد حتى في الممارسه بعتمد على الكوبيشن كتير.
اوكي، قلت شنو في الممارسة تعتمد على الكوبيشن؟
ايوه كنت بعتمد على الكوبيشن اكثر حاجه، يعني
شوف
الكلام معجن
طبعا
صعب يعني
مفهومك تغيره تماما، يعني احنا في اي حته، حتى يعني المفروض حتى في السودان الدايركت كوميونيكيشن مع العيان وبعدينك حتى تمشي للكوبيشن، ما العكس.
اوكي
خلاص يلا اول حاجه قبل ما نبتدي نفتح هناي نفتح الكومنتس. اول حاجه انا ممكن اقول لك في حاجات مثلا الليله مشت كويسه، في حاجات الليله شويه ممكن تكومنتها. انت والحاجه مثلا هو فتح he introduced himself كويس، انت رحبت بيه، ولكن يعني انت في الاخر في مسافه لحد ما انت introduce yourself. اول ما يبتدي تفتح الفينيات دي انت طوالي هو قال لك انا my name is Michael and I'm here to see you to the psychiatric clinic. قول له hello Michael, my name is Dr. خلف الله, I'm the psychiatrist here today, I'm here to see how can I help you, what brings you in. شفت دي عباره عن باكج طوالي كده تنطقها مره واحده، فهمت؟ انت كده اول حاجه you reciprocate, you بتسلم عليه back, you introduce yourself كويس، وبعدين تبتدي انت الكنترول عندك، انت you start with the open-ended question. So my name is خلف الله, I'm the psychiatrist here today, I'm here to help you. So can you tell me what brings you here today? انت عندك الكنترول. هيقول لك I'm hearing voices, the voices are telling me to do so and so, what is going on here. طوعي شفت شنو، ما تقول ليه الليل عشان تشو empathy، ما تقول له I understand you. هقول لك لا you don't understand me. انت في الاخر الليله شنو يعني، انت he's hearing the voices you're not. انت ممكن تقول له this sounds horrible كويس. انت في الاخر انت ما it's coming is very genuine. انت ما مر بالاكسبيرينس، لكن انت can tell him this sounds horrible. انت you don't agree انه الاكسبيرينس حقيقه ولا ما حقيقه، هو هسه افتكر انك انت موافق انه الاكسبيرينس حقيقه. it sounds horrible, can you tell me more about the voices. خلاص انت عرفت انه voices, can you tell me more about the voices, for how long has been going on. هتبتدي بالvoices, what about these voices, what kind of voices, what do you hear exactly, how often do you hear these voices, for how long you've been hearing them, when did they start, are they getting worse, getting better, has anything happened recently, he stopped taking the medicine, why do you think the medication is not working, لا it's not working, what medication were you taking, I was taking this medication, did it make the voices go away, لا, did it help you, لا, did it cause any side effects, yes, did you ever had the voices gone, like what are the voices telling you, the voice telling you to hurt people, are they telling you to hurt yourself, لا. Okay, anything else that is bothering you other than the voices. قال لك انه he's thinking that people are against him. Tell me more about this, who, why, what's going on, any changes recently, have you been taking any, خلاص انت الليله مثلا other symptoms. It's very detailed history. ما عندك الليله 15 minutes، فانت you get to ask the patient all these questions back to back. Focus history على الفويسز، على paranoia، على delusions, unusual experience, suicidal thoughts, not suicidal thoughts. بعد شوي عايز تسأل عن depression. انت عندك 15 minutes. Depression, manic symptoms. عندك الليلة هناي, any changes in the medicine, any substance use recently. حتمشي للpast psychiatric history. Have you ever had this, for how long have you had this experience? Have you been to the hospital before? Have you tried to hurt yourself? What medications have you tried? Any health problems? Any يعني شفت انت you go systematically يعني انت عندك 15 minutes ف you should cover expectations كل الحاجات دي كويس.
اوكي
فانا افتكر انه انت بس انت you're trying to connect with him وبعدين هو سمعك ما سمعك. بعدين لما يتكلم انا شايفك انت يعني كان في شغل انه مثلا بتقاطعه في مس كوميونيكيشن حاصل بعدين بيسكت هو. فخليه يتم كلامه وبعدين انت ممكن تسال سؤالك.
اوكي
خلاص.
فهمت.
فدي كلها
اوكي
فيدباك. انا افتكر الاكزامبل بتاعت الليله دي ممكن ناخد فيها اقل شيء ممكن يعني two people كويس. فدي كلها فيدباك انه مثلا how to use the time efficiently في الكوميونيكيشن. لكن اي مثلا the next person اللي حيشتغل في الكيس دي يعني how to يعني try to use the time efficiently here. اول حاجه my name is فلان الفلان. I'm the psychiatrist here today. How can I help you? What brings you in today? I'm sorry that this is what's going on. Tell me more about these experiences. This sounds terrible. Can you tell me more? This is how you show empathy. If Galik, I don't trust you, I'm like, this sounds horrible that you cannot trust people. However, it's our job. We assure you that everything you're saying here is confidential. And هنا we're here to help you. خلاص. يعني ما حتضطر تعيد الموضوع ده كتير. It's once or twice. It checks انك انت الليله you're showing يعني empathy انك انت understand ان زول ما he's not trusting you until you show the empathy. He's distressed, you're showing empathy. خلاص.
اوكي
طيب
تمام.
كده انا حقوم بس انا هعيدها تاني هنا هعيد الفينيت تاني عشان ندي فرصة للناس. شفتها الزول الجاي منه دارين زول تاني متبرع نفس الكيس. اخوان الناس دي ساكتة خجلانة. يا جماعة فولنتير تاني
السلام
65 زول.
عليكم.
وعليكم
السلام
السلام.
عليكم. السلام عليكم. أنا نمارق الحسن يا بوس.
ما قدمتي قبل كده؟
أي
طب ندي
قدمت في
فرصة لزول ما قدم
الفلتريشن.
أول.
طيب حاضر. I am in the backup. كويس.
تسلمي. في زول يا إخواننا زول ما قدم أنا ما معي الليستة. لأنه في الآخر الليستة للناس اللي قدمت دي حتمشي دكتور عبد الغني.
الو السلام عليكم.
وعليكم السلام ورحمة الله. مروة
مروة.
قدمتي ولا ما قدمتي قبل كده؟
أنا دكتور محمد.
لا ما قدرت،
محمد
لكن ما مشكلة خلاص ادي دكتور محمد ممكن اجرب في الكيس القصيرة.
دكتور محمد معانا؟
الصوت شكله
ما سامعنا. مروة جاهزة؟ ما سامع دكتور محمد هنا.
اوكي طيب.
هاي سامعك كده يا بص. الصوت
واصل.
كده
اوكي مكسب. دكتور محمد قدمت انت قبل كده ولا لا؟
لا ما حصل والله.
طيب مروة
الشبكة دي
تقدمي
اسمها
بعدها ان شاء الله. اوكي نفس الكيس يا محمد. عندك 15 دقيقة. خلي الحاجات دي في بالك. اوكي انت 15 دقيقة to be focused. This is a psychiatric history. Introduce yourself. Open-ended question. Follow-up question is focused على الكيس schizophrenia. اوكي جاهز يا محمد؟ محمد يا محمد
سامعك يا بص. أنت سامعني؟ سامعك أنا.
انا
ألو.
سامعك هسه. جاهز؟
أنا جاهز يا بص. هاي
يلا حفتح الكيس اللي طوالي.
Hiya, mate. How's it going? Are you still there?
وين انا حقفل الكيس افتكر في مشكله في الشبكه يا محمد.
الله مايكل. والله الصوت ده ما سامع مقطع.
انا
ألو.
محمد انت هناك كان في زي بيتكلم مسافه. انت الشبكه عندك كويسه ولا لا؟ انا قفلتها لانه ما كان سامع منك شيء.
والله الشبكة أنا عندي بسمع الصوت مقطع يا بص، لكن كده هسه الصوت واضح أنا بالنسبة لي.
طيب انا
ما
هعيدها مره
عارف انتوا
ثانيه.
سامعين صوتي ولا ما سامعينه، لانه حقيقة
هسه
صوتي كده
سامعك هسه.
واضح.
هسه
كده
سامعينك.
صوتي واضح يا بص، كده صوتي واضح.
هسه سامعك، هفتحها ثانيا كويس.
صوتي واضح كده يا بص.
صوتك واضح، انا هفتحها ثاني. لو في مشكله بتاعت شبكه افتكر بس حنتجاوز بعدها، لكن خليك جاهز. في 20 دقيقه. It's more than enough to gather everything. جاهز يا محمد؟
واضح.
محمد جاهز؟
انا يا بص بتكلم، انتوا سامعيني؟
ما بيقطع بيجي. محمد اوريك شيء، الشبكه عندك ما مظبوطه، افتكر بس حنتجاوزك الليله. طيب.
اه.
إيه؟ كده حاول مره واحده، اذا لقينا الشبكه ما مظبوطه حكفيها انا. دايرين واحد في الاخر شبكته كويسه في الاخر. حفتح مره واحده، جاهز هسه؟ محمد. يا محمد.
جاهز جاهز يا ابو صاي.
طيب لو لقينا في مشكله بتاعت شبكه حنوقف الكيس وحنتجاوز، يقوم يوم ثاني عندك الشبكه احسن نواصل بها، لكن حنفتح هسه.
كده صوتي واضح مش يا بص؟
صوتك
ايوه.
واضح. انا هفتح
كده
هسه.
كويس.
Hiya, mate. How's it going?
Hello Michael, my name is Muhammad. Dr. Muhammad, I would like to talk with you today to understand how you would. Hello?
Oh, sorry, Mohammed. My head's all over today.
Is that okay?
Yeah, all right. You can talk to me. But I need to know, are you with them? Are you actually a doctor
Hello
or are you
Michael,
here
my
for
name is
something else?
Dr.
Just
Muhammad.
be honest.
So- Hello Michael, my name is Dr. Muhammad. I'm a psychiatrist here. I would like to talk with you today to understand how you have been feeling recently. This will help us support you better. Is that okay?
Yeah, I guess that's okay. But you need to promise me you're not with the people who are trying to watch me. I keep hearing things like voices, and someone keeps saying they want to put a chip in my head. It's hard to trust anyone lately. But you can ask your questions.
أنا بس ما أعرف أنتوا سامعيني، سمعت أنا الصوت وبقطع.
Are you still there? Are you still there?
يا اخوانا افتكر نقفل، شوف لنا واحد شبكته كويسه. مروه لو جاهزه حنوقف هنا وحنعيد تاني.
اوكي
معلش يا
تمام.
محمد نعتذر منك. دقيقه. دقيقه.
طلع يا بص، ما أعرف ولا الشبكة.
لما الشبكه كان فيها مشكله، فما بس عشان شفت تبقى بس نستفيد من الزمن. دقيقه. لكن بدايه كويسه من محمد كانت
يا
في
يا دكتور ياسر،
ايوه محمد.
معلش أنا طلعت ودخلت تاني ما أعرف.
لا معلش ما مشكله،
الشبكة دي
هي
فيها
عندك في مشكله
زي.
في الشبكه ما حتنفع في هناي في انك تستلم الكيس الليله. ان شاء الله يوم ثاني يكون الشبكه عندك احسن. لكن
أه.
بدايه كويسه انك انت في الاخر يو انتروديوس يور سيلف واكسبلين الرول بتاعك ليه. دي كان بدايه كويسه، بس المشكله في الشبكه بعدها ما ساعدتك.
ألو.
طيب
أبا بص أنا بعتذر، الشبكة شكلها كعبة، ما أعرف أنتوا
ما في
سامعيني
مشاكل،
كده.
ما في مشاكل، يوم تاني الشبكة يكون عندك أحسن. مروة
ايوه.
يلا اتفضلي.
اوكي.
Hiya, mate. How's it going?
Hello, I am Dr. Marwa, the psychiatrist in the clinic today. How may I help you today?
Hi, Dr. Marwa. Yeah. I don't really know why I'm here. My GP said something, but honestly, I think people are messing with me. I just want to make sure you're not involved, you know? Because lately, it feels like everyone's watching me.
I'm sorry that you are feeling like that, but I am here and everyone here, we are trying to help you. And so tell me more about the problem.
Well, it's hard to explain, but I keep hearing this voice, man. Like, it's not my own thoughts. It's loud sometimes, telling me they're coming for me. And I feel like someone's trying to put a chip in my head or something. Like, when I sleep, I wake up and I feel weird. Like, there's something inside. No one believes me. It's scary.
Okay, I'm really sorry you are feeling all of that. So I'm going to ask you a few questions about the things you are complaining of. So tell me, can you tell me when did this start, these symptoms?
I think it started again maybe 2, 3 weeks ago. It's been getting worse since then. At first, it was just the feeling of being watched, but now it's the voices too. I can't really remember what triggered it. Maybe it's stress from work, not sure.
Okay, so you said again, so this is not the first time you are experiencing this.
Yeah, it's not the first time. It happened before, back in Nigeria, and even after I moved to the UK, but it was better for a while, you know, when I was taking my meds and all that. But now it's just come back again, like even worse.
Okay, so anything change in your routine? Like, did you stop your medication or change the dose or something?
Yeah, I stopped taking the tablets about a month ago. I just felt like they were making me slow, and I thought maybe I don't need them anymore. But after that, things started to go bad again. Honestly, I just wanted to feel normal.
Okay, so you said first it started with like feeling being a feeling of being watched, like sorry, um, and then you said there is a voices. Like, how many voices you are hearing?
It's usually just one voice, but sometimes it sounds like two. One is deep and always angry, saying, I can't trust anyone. The other one whispers, like it's warning me about people. Both of them will have to keep me up at night. It's hard to ignore.
Okay, and they are like they are friendly voices or like angry voices or like, how do you feel about the voices?
Mostly they're not friendly. The deep one is always angry, shouting, telling me I'm in danger. The whispering one just makes me anxious. Keeps saying people are after me. I feel scared and confused. Sometimes I just want them to stop.
Okay, I'm really sorry that you are experiencing this. And do you see sometimes you feel like you're seeing something that other people cannot see?
Not really seeing things, no. It's mostly the voices and like just feeling things crawling in my head, like something moving inside. Sometimes shadows move in the corner of my eye, but I don't see people or anything like that. It's mostly the sounds and the feelings.
Okay. And all these symptoms, how does it affect your work and your daily life?
It's been rough, honestly. I can't focus in the kitchen. I forget recipes, mess up orders. My boss noticed I'm not myself. I don't talk to my friends much anymore. And my family keeps asking if I'm okay, but I just get annoyed. I feel tired all the time.
Okay. So I'm going to ask you another question about the voices. Are they telling you to harm yourself or harm other people?
No, they don't tell me to hurt anyone. They just keep saying people are after me, that I can't trust anyone. Sometimes they say I should hide or not talk, but they never say to hurt myself or others. It's just fear, not anger.
Okay. And do you use any drugs or substance?
Yeah, I started smoking a bit of weed again. Just sometimes when I can't sleep or when the voices get too much, it helps me calm down. But I know maybe it is not good for me. I just feel stuck, honestly.
Okay. Do you drink alcohol?
Not really. Maybe a beer once in a while, but nothing much. I don't like how it makes me feel, honestly. Mostly just the weed lately.
Okay. So what about like your daily activities and your self-hygiene and these activities? Are you able to do these things like usual, or it's difficult now?
It's difficult, to be honest. I don't always shower or eat properly. Sometimes I just stay in bed all day. Cooking at home feels like too much. I used to take care of myself better, but now everything just feels heavy.
Okay. What about your mood in the past few weeks?
My mood is mostly flat. Like I don't feel happy or excited about anything. Sometimes I get angry or frustrated, especially when people don't believe me. But mostly I just feel numb or tired.
Okay. Then can you tell me more about like when you were feeling okay before all this happened? Like how was your daily activities? How was your work? How was your life before these symptoms?
Yeah, before this started again, things were much better. I was working full shifts at the restaurant, enjoying cooking, talking to my friends and family. I'd go for walks, keep my place tidy, even try new recipes at home. I felt more like myself, no voices, no fear, just living normal, you know?
Okay. So you said this happened before and you were taking medication for it. Have you ever been hospitalized in a psychiatric hospital or psychiatric clinic?
Yeah, once back in Nigeria, when it first started, my mom took me to the hospital because I was really not myself. I stayed there for about 2 weeks, I think. After that, I started on the tablets and things got better. Haven't been admitted since moving to the UK.
Okay. So you told me you stopped the medication because it made you feel slow. Like it was always like that, or something changed in the medication, like increased dose or reduced dose or anything?
It was always kind of like that, just made me feel tired and not sharp, like my head was heavy. The dose didn't change, I just got tired of feeling that way. I wanted to see if I'd feel better without it, but things got worse instead.
Okay. Then can you tell me about the type of medication you were? Do you know the names of the medication you were taking?
Yeah, I was taking aripiprazole, just one tablet every day. My GP said it would help with the voices and the paranoia. It did help for a while, but I didn't like how it made me feel, so I stopped. No other meds, just that one.
What about the other meds? What other medication you are taking?
I'm not taking any other medication, just the aripiprazole before. I didn't have any other tablets, not for blood pressure or anything like that. Only that one for my mind.
Okay.
All right. Is there anything else?
Talking about, yes, sorry. Can I go back again to the voices? You said there is one or two voices. Are they talking to you directly or they are talking together?
Mostly they talk to me directly. The deep one shouts at me, tells me things about people wanting to hurt me. Sometimes the whispering one talks to the deep one like they're arguing, but most of the time it's just at me. It's confusing.
Did you take any actions depends on these voices?
Sometimes, yeah, like if they say someone's watching me, I'll close the curtains or check my phone for tracking. Once I stayed home from work because the voice said it wasn't safe. Mostly I just try to ignore them, but it's hard.
Okay. Then can you tell me more about your thoughts? Do you
My
have
thoughts are
problems?
jumbled.
Yes? Tell me more about your thoughts.
My thoughts are all over the place lately. It's like my mind's racing and jumping from one thing to another. Sometimes I can't tell what's real and what's just in my head. I keep thinking someone's trying to track me or control me. Like that cheap idea. I get worried something bad's going to happen, even when there's no reason.
These thoughts in your mind, do you think it's yours or someone else?
Sometimes it feels like they're not mine, like someone's putting them in my head or controlling what I think. Other times I know it's me, but I can't stop the thoughts. It's hard to explain, but it doesn't always feel like my own mind.
Okay.
All right, is there anything else you want to ask or should I just wait?
Do you have any family history of psychiatric illness?
Not that I know of, no. My parents never talked about anything like this. No one in my family has been to a psychiatrist or taken tablets for their mind, as far as I know, just me.
Okay. Then do you understand or do you think you have a medical problem or psychiatric problem?
Honestly, I don't think there's something wrong with me. It feels more like something outside is happening. Like people are really after me or trying to mess with my head. I know doctors say it's an illness, but it doesn't feel that way to me.
Okay. When you were in Nigeria and the doctor prescribed for you this medication, did they tell you what is it? Like, did they name the disease you have?
Yeah, they said it was something called schizophrenia. They explained it a bit. Said it makes people hear things or feel paranoid, but it just sounded like a label. I didn't fully understand it, to be honest. Just took the meds because my mom said I should.
And you think you felt better after taking the medication?
Yeah, I did feel better after a while. The voices got quieter, and I could go to work and talk to people again. Life felt more normal, but I still didn't like how slow the tablets made me feel. So I stopped them eventually.
Okay.
All right, doctor, is there anything else you want to know, or can I go now?
So I need to know, like, if we give you another medication or if we tell you to go back to the medications, will you agree to take the medication?
I don't know, honestly. I don't like how the meds made me feel before. But if it means the voices stop and I feel normal again, maybe I try. But I'm worried about feeling slow. I just want something that works without making me feel like a zombie.
Okay. Do you have any other beliefs that you think people will tell you are the only one thinking like that? Like abnormal
Yeah, maybe.
beliefs?
I still think someone's trying to put a chip in my head. I know people say it sounds crazy, but I feel it sometimes like something is under my skin. And I keep thinking my phone or telly is watching me. If no one else believes it, it just feels real to me.
Okay. Do you sometimes have any abnormal sensation?
Yeah, I do. Sometimes I feel like there's something crawling or moving inside my head, like a tingling or buzzing. It's not pain, but it's uncomfortable. Makes me feel like there's really something there, like that chip I was talking about.
Okay. Do you think you are you
All right.
have any bizarre actions, like abnormal actions you are doing, people are commenting on?
Maybe. My family says I act strange. Like I check the windows a lot, close curtains, avoid talking to people. At work, I get quiet or leave early if I feel watched. People notice I'm not myself, but I don't think I'm doing anything that weird. Just trying to stay safe.
Okay. Have you ever had any period of low mood or very high mood in these past weeks?
Mostly low mood, yeah. I feel down, tired, no energy. Haven't had any times where I felt really high or overly happy. It's just mostly flat or sad. Nothing like being super excited or anything.
Okay. And how is your sleep?
Sleep's bad. I can't fall asleep easily. The voices keep me up. And sometimes I wake up in the night feeling scared or like something's wrong. Most nights, I don't get much rest at all.
What about your concentration?
My concentration is really
What about your concentration?
my concentration.
Okay, Michael, like, do you feel difficult to concentrate or you follow people while they are talking or while doing some task?
Yeah, it's hard to concentrate. My mind drifts off or I get distracted by the voices or my own thoughts. At work or when someone's talking, I lose track of what's going on. I forget things more now. It's frustrating.
Okay, can you tell me more about your social life before all this?
Before all this, I was more social. I used to hang out with friends after work, call my family back home, even go out sometimes. I enjoy talking to people, sharing food, laughing. Now, I just avoid everyone. I miss that, honestly.
Okay. Do you feel safe
All
at
right,
home?
doctor. Do I feel what, doctor? Could you say it again? I'm not sure what you mean.
Do you feel safe at home or work?
Not really. At home, I keep checking the locks and windows. At work, I feel like people are watching or talking about me. It's hard to relax anyway. I just always feel on edge, like something bad might happen.
Okay, what about your memory recently? Do you think you forget like the task you have done like yesterday?
Yeah, my memory is not great now. I forget little things like if I ate or what I did yesterday. Sometimes I start something, then forget what I was doing. It's much worse than before all this started again.
Okay.
All right, doctor. If you have more questions, just let me know.
Did you come here alone?
Are you still there?
Did you come here to the clinic alone or with someone else?
I came alone today. My sister wanted to come, but I told her not to bother. I just wanted to get it over with by myself.
Okay.
All right, doctor, just let me know if you need anything else.
Okay.
Okay, thanks. Can I go now, or is there more you want to ask?
Oh, you can go now. معلش
All
دكتور
right,
ياسر
thanks.
أنا
I'll just
مخي
wait
فضى خلاص.
outside then. Sorry, doctor, I didn't catch that. Can you say it again? I'm a bit confused.
Okay.
Are you still there?
Yes, I'm still there.
Okay, good. Just
You
check.
said
Let me know if you need anything else from me, doctor.
okay. Have you ever felt in these past weeks, have you ever felt so hopeless that you felt you want to, that the life is not fun anymore or?
Yeah, sometimes I feel really hopeless. Like nothing's going to get better, and I'm just tired of it all. But I haven't wanted to end my life or anything like that. I just feel stuck and fed up, wishing things would change.
Okay.
All right, doctor. If you have more questions, I'm here. Otherwise, can I go now?
Thank you very much for your and I don't know.
طيب
Okay.
فكر. لا ما عادي عادي شوفي it's a different يعني patient population, different language, different experience. فما يعني it's الواحد شويه ما بيتعود عليها. that's افتكر يعني overall يعني الناس ابتدت شويه تمسك في الموضوع، يعني في الفلو، في الايديا، هنا في الديتيلز. لكن overall يعني انت had control about the interview الى حد ما. شويه افتكر toward the end انت شويه يعني ما كان في مثلا اسئله بلقيت تفتشي في هناك
Bye.
في راسك انك تسالي شنو ما تسالي شنو. ف that can help you sometimes انت لما يكون عندك فلو بتاع يعني questions زي دي، انت الليله بتسال في هناك symptoms الحاصل جابوا هنا شنو ما شنو، خلصت بدري خلاص ما في مشكله. انت what do you think went
Okay.
well؟
Like most of my open-ended question يعني البيشنت كان بدي يعني very يعني a lot of information، فكانت يعني البيشنت cooperative
اه
في معظم السيمتومز. ما
اوكي.
أعرف، حسيت إني عملت assessment معظم يعني البوزيتيف سيمتومز، بعض النيجاتيف سيمتومز يعني. أنا حسيت كده.
yeah. وهو زي ما قلت he was very cooperative. انت لما بديتي في الاول he was giving you the details of the symptoms. انت اول حاجه you introduced yourself, you very well started by having an open-ended question، وبعد شوي حبة validation ذاته للsymptoms يعني للcomplaint explanation للرول بتاعك، وبعدين حبة details. انت بقيت تمسك الsymptoms one by one detail by detail. if you go checklistي ما في حاجة غلط. لكن انت حتى افتكر at the beginning you went beyond becoming checklisty with the question. وchecklist انت you're gonna cover all the details. لكن لما قال لك I started hearing the voices before, this is a cue. فانت وقفتي هنا سالتيه انت did you hear this before. انت you followed up on cues provided by the patient during the interview. دي حاجه كويسه في الاخر. ف it was not
Okay.
all checklist يعني مثلا كده كده تفاصيل تفاصيل. لكن this is went well. What did you feel did not go well?
صراحة أنا في يعني most of the question like دكتور خلف الله قال إنه معظم يعني متعودين نسأل ال co-patients. ف sometimes it's difficult to ask the patient directly about some of the symptoms لأنه هو he's experienced the symptoms، فكان صعب إنه أحاول أحور السؤال بحيث إنه أقدر أعرف. لكن هو برضه اداني إجابة كويسة. يعني مثلا ال bizarre thinking is if the patient is believing that this is actually real, how do I ask the patient like this is bizarre. So يعني فأنا حاولت ألفلف في الأسئلة. went badly برضو إنه أنا حسيت يعني I followed some of the cues like ما قلت، لكن ضعت من الهيستوري الباقي يعني. حاسة إن في حاجات كبيرة ما حبشتها،
Okay.
فما أعرف ألخصها.
So missed some topics during the interview. لكن
Yes.
هي في الاخر انت كنت ماشيه كويس. الموضوع ده افتكر الموضوع بتاع تدريب. قصه انه الهيستوري بيتاخد من الكوبيشن ده، افتكر الناس ذاته يعني حققتوا عليه. that's not the way it should happen. انت تتكلم مع العيان اول، تاخذ الهيستوري مع العيان. ان شاء الله كان الهيستوري خارم بارم، ان شاء الله كان الهيستوري لا في السما لا في الوطن. انت you take the information from the عيان وبعدينك you add collateral information بعدينك not the other way around.
أوكي. برضو حاجة تانية أنا حسيت إنه أنا focused on the questions and the answers، وبعدين I failed to empathize with the situation في بعض الحتات يعني. كنت بسأل السؤال اللي بعده واللي بعده،
ما
وهو
خلاص
مرات بيقول يعني
ما يعني
اوكي.
انت should do it. لكن كثرتها ما كويسه عشان تقعد تعملها
اوكي.
كل شويه. ما حاجه كويسه. اوكي in the beginning طوق ما مع كل سؤال. في الاخر ما انت اوكي tell me like sounds horrible like can you tell me more about this. مره مرتين ثلاثه خلاص. It's not always.
اوكي.
What do you think you could improve on?
ده history taking كله.
Okay.
اوكي.
وانا افتكر الزول اللي بيخش هنا هو اكتر زول بيستفيد، عشان كده عشان بيتدرب. انا افتكر نخش ندخل الاسسمنت ونشوف بيقولوا شنو، وبعدين نمشي في الكيس تاني بعدها.
اوكي.
overall performance pass. وطبعا انت يعني اول زول باصه معانا، انا قديت ذاتي لما اخذت الاسئله، لانه يعني الفرق بين دي وبين اللي قبله. This is not a focused interview. This is a more detailed interview. كان عندك 20 minutes.
كان طويلة هاي.
It
اوكي
gives you all
الحمد
give you all the time عشان انك الليله to cover areas بتاعتك. الفوكس question دي بتغش الزول شويه، بيكون انه هو
لله.
عايزك فوكست، واحنا بنكون دايرين نعمل فول انترفيو، فدايما بيكون انت في انفورميشن هم عايزينك تجيبها ما جبتها. انا حقرا الاسسمنت
اوكي.
very fast we're gonna go عشان to move on to the next patient. Personalized
اوكي.
feedback. The doctor demonstrates a solid approach to a psychiatric history taken with Michael Okoyo, covering the majority of the essential domains. The strengths of the consultation include a clear focus on the presenting complaint, detailed exploration of psychotic symptoms, including hallucinations and delusions, and an adequate risk assessment. The questioning was generally open and encouraged the patient to elaborate, and the doctor maintained a supportive, empathic tone throughout. There were some areas for improvement, particularly the depth of medical history, the assessment of cognitive functioning, and more structured approach to exploring risk from others. The consultation could also have benefited from greater exploration of the patient's personal and social background, more systematic coverage for physical health. Doctor post brief reflection that they asked several ended questions, that the patient was cooperative, uh, and the patient was cooperative, is accurate, but more use of open-ended question. Allah. Okay. Okay. وين احنا قلنا the more use of open-ended question, and summarizing could have enhanced rapport and information gathering. Overall, the performance was competent with room for development in consultation structure and comprehensiveness. Information gathering, identifying. افتكر هنا بيكون دايما في repetition حاصل. اوكي، عشان كده بس افتكر نتجاوز هي دي من حاجه بس الحته الاولى ديك. Okay, حكينا نقرا هنا. Identifying key issues and priorities, the doctor effectively identified the main concerns. طيب دي praising you في الحياة main concern, assisting historical context and relevance. The doctor appropriately explored. طيب elicitation of presenting issues and details. Okay. Conducting risk safety. قال لك however, risk from others, actual abuse or exploitation could have been explored in more detail given the patient persecutory relief. Evaluating physical health and perspective, طلب منك الآخر, you did not systematically inquire about chronic medical conditions, allergies, general physical health. A more thorough approach could include questions such as, do you have any other medical problems or take any medications for physical health? Gathering psychological social support environment. قال لك انت obtain حبة information on occupation. لكن however, there was limited exploration of early life, education, or deeper social context. Further questions about the relationship, support system, environmental stressors would have enriched the assessment. ما انت عندك 20 minutes and they can ask you for more. Communication.
Okay.
Consultation structure, well organized, progressively logical, from presenting complaint to history, risk, and social context. However, the interview sometimes, like signal posting and summarizing, which could aid coherence, for example, after exploring the voice on medication adherence. A summary statement such as, so just to recap, you've had these symptoms before and they improved with medications, but have returned since stopping it, could have reinforced the understanding. Consultation style. Consultation was supportive and patient-centered, frequently expression of empathy. I'm really sorry you are feeling all that. The approach was conversational rather than interrogative, which helped to put the patient at ease. At times, the questioning could have been more open-ended to encourage fuller response. Attitude, the doctor maintained a non-judgmental, compassionate. Okay, نواصل هنا. Listening skills, the doctor demonstrated good listening skills. Accept. Questioning style, the question had used a mix of open and close-ended. There were some repetitive or leading questions, and more open-ended exploration could have facilitated richer patient narrative. Language use, the language used was generally clear, simple, and accessible. Okay. Overall, this was a good assessment. طيب. Who's next يا جماعة؟ احنا we're going to improve every time زول ياخد الكيس دي ونعمل زيادة وزيادة. Who's next؟
يا جماعة who's next؟ عايزين يحنسوكم يعني ولا شنو؟ who's next؟
والله ده امتحانيس الليلة دي.
السلام عليكم.
اختار من الليسته
السلام عليكم.
يا ياسر.
شايف ايمان عمر قدمتي قبل كده ولا لا؟
لا ما قدمتها. يمكن يقدم.
طيب.
خلاص يلا كنت هختار من الليسته. طيب تفضلي.
طيب انا هقرا الهناء البري ريدنج اذا لقينا طريقه على حسب الكيس قصيره ولا ما قصيره. يفوز قصيره ممكن نشتغل فيها 2 و 3. خلاص. البري ريدنج psychiatric history and risk assessment of Jason Doe. In this situation, you will be taking a psychiatric history and conducting a risk assessment for Jason Doe, a 33-year-old individual detained under mental health legislation. Understanding the context of employing effective communication skills are crucial in this scenario. دي شكلها برضو احتمال تكون عبارة عن 20 minutes. فإذا 20 minutes هنعمل واحدة بس. Understanding the context, Jason Doe was found wandering the streets late at night and reported evading imaginary pursuer. He exhibited signs of distress and possible hallucinations. Police noted a strong odor of cannabis suggesting substance use. He has been detained under mental health legislation, indicating a concern about safety and well-being. Key areas to explore in psychiatric history: presenting complaint, detailed account of the incident leading to detention, clarify the nature of the voices or perceived threats. Explore any associated symptoms like paranoia or disorganized thinking. Psychiatric history, previous psychiatric diagnosis or treatment. History of similar episodes or symptoms. Compliance with any ongoing treatment. Substance use, extent and frequency of cannabis use. Use of other substances, including alcohol and prescription or illicit drugs. Impact of substance use on his mental state. Medical and surgical history, relevant medical conditions that could influence mental health. History of head injuries or neurological conditions. Family history, mental health disorders in the family, family dynamics and support system. Personal and social history, employment, relationships, and living situations, coping mechanism and stressors, social support and isolation. Communication skills, establish rapport and trust early in the interaction. Use open-ended questions to elicit detailed responses. Demonstrate empathy and validate patients' feelings. Maintain a non-judgmental stance to encourage openness. Be mindful of the patient distress and adjust your approach accordingly. Risk assessment. Assess risk to self, including suicidal ideations or plans. Evaluate the risk to others, including considering the details of the incident. Consider the risk of self-neglect or inability to care for oneself. Assess the potential for substance use to exacerbate risks. Questions to consider asking: can you tell me more about what happened the night you were found? Have you experienced anything like this before? How has your use of cannabis affected your thoughts and feelings? Do you have a support system or people you trust to talk about your experience? Have you ever felt like harming yourself or others? In this simulation, your ability to gather comprehensive psychiatric history and conduct a thorough risk assessment will be crucial. Your communication skills will play a key role in facilitating an effective and empathetic interaction with the patient. طيب إيمان، زي ما الكيسز القبالة خلاص، خشي
Okay.
طوالي introduce yourself. My name is Dr. Iman. I'm the psychiatrist here today. I'm here to help. What brings you here today? Open-ended question طوالي. Introduce yourself, open-ended question. And then depending on the context بتاعتك انت مثلا الليلة قبضوني انا ضربوني I'm sorry to hear about what happened to you. بعد شوية open-ended question. Follow up with open-ended question. بعدينك مثلا تبقى close-ended question. لكن هو بيديك الانفورميشن. ما قاطع العيان، خليه يخلص كلامه. بعدينك verify information.
Okay.
على حسب الكيسز اللي فاتوا كانوا 20 دقيقة. إذا دي 20 دقيقة عندك زمن كفاية إنك تاخذ ديتيلز، واحتمال يكون ده الكلام هنا ذاته زي 20 دقيقة.
طيب.
طيب based on the pre-reading, what did you learn?
I learned more about how to take detailed risk assessments.
What do you feel confident about? I'm confident in related to the topic.
I'm confident in taking the history of presenting illness, presenting complaint.
Okay.
Mm.
في حاجة أنت want to develop ولا work on?
need to be systematic. يعني أيوه.
يلا هنبدأ.
Okay.
They just won't leave me alone. Please get them away from me.
Hello, Jason. My name is Dr. Iman. I'm the psychiatric resident. I'm here to help you. Could you please tell me what brings you here today?
Help, right? You're with them, aren't you? I knew it. I knew someone would send someone. Look, I was just trying to get away. They're after me, always watching. I had to keep moving.
Okay, Jason, could you please clarify what happened before you came here?
I told you I was running. I couldn't stay in the flat, not with them whispering all night. I went out, tried to lose them, but they kept following. Then the police grabbed me, said I was acting strange. I wasn't. I was just trying to get safe.
Okay, so just to make sure that I understand you correctly, you have been feeling that you are watched by someone and you were act in a strange way. That's why the police catched you. Is that correct?
Yeah, but it's not just feeling, it's real. Someone's out there watching me, tracking me. The police, they don't get it. None of you do. I had to run. What else was I supposed to do?
Okay, it sounds horrible, and I'm sorry to hear that. Could you please tell me more about what happened?
It started in the flat. The voices got louder, telling me things, horrible things. I saw shadows moving right in the corner of my eye. I tried music. I tried to smoke to calm down, but nothing worked. I just panicked. Had to get out.
Okay. Okay. So you said that you were hearing voices. Is that correct?
Yeah, that's right. They're always there, whispering,
Yeah.
sometimes shouting at me, telling me I can't trust anyone. Even now, I hear them. I can't switch them off.
Okay. Okay. So Jason, could you please tell me more about these voices? Is there...
دي شكله قفل من عنده، فاحتمال أعيد السيميليشن تاني.
اوكي، ما في مشكلة.
دقيقة. بس الحركة دي قبلك أعملها، لكن ثواني.
أنا شوية البريتش accent يمكن
الله
هذا كان
ده
شديد.
نسأل دكتور عبد الله ده ديل الناس يا تحل ديل.
دايرين ترجمة.
حاول تبقي فوكس في الأسئلة بتاعتك هسه، لأنه أنت عرفتي اوريدي حبة
إيه.
انفورميشن، فما إلا تعيديهم تاني، مثلا أسأليهم تاني لكن فوكس في الأسئلة. أنا هفتح تاني هسه. جاهزة؟
طيب جاهزة أيوة.
They just won't leave me alone. Please get them away from me.
Hello Jason, how are you? My name is Dr. Iman. I'm the psychiatric resident. How can I help you?
How can you help? Can you actually stop them? Because no one else listens and they're still out there waiting. I just want to be left alone.
Okay, no problem. Jason, I'm here to help you. I would like to know what happened exactly before you came here. Please.
I was just walking, trying to get away. They were following me. I could feel it, watching me from the corners, whispering. I didn't do anything wrong, but I had to keep moving. If I stopped, they'd catch up.
Okay. What happened is that someone was following you. Is that correct?
Yes, I told you. They were right behind me, hiding. I kept hearing them. Whispers, footsteps. I couldn't trust anyone, not even the police. They think I'm mad, but I know what I heard.
Okay, I'm so sorry to hear that, and it sounds terrible. Could you please tell me more about what happened?
I was in my flat, right? Then it started voices, shadows moving where they shouldn't. I heard them say my name, threatening things. I tried music, tried shutting the windows, nothing helped. So I left. I thought maybe if I kept moving, they'd stop, but they just got louder.
Okay. Okay, Jason, are you talking about the police or someone else?
Not the police, other people. I don't know who they are exactly, but they're watching me, talking about me. Sometimes I hear them through the walls, sometimes it's just in my head, but they're real.
Okay, I understand that. So, Jason, I would like to ask more about what happened. You said that you hear voices, people voices, threatening or like following you. Is that correct?
Yeah, that's right. They say things that like they know what I'm doing. They're coming for me. Sometimes they whisper, sometimes they're shouting. It's never quiet. Even now I can hear them.
Okay. Okay. So I would like to ask, do you see these people or you just hear their voices?
Mostly I just hear them, but sometimes I catch a glimpse, shadows or shapes out the corner of my eye. I know they're there, even if no one else sees them. It's not just in my head.
Okay, okay. I understand that. Jason, could you tell me more about these voices? How many are they?
It's hard to say. Sometimes there's just one, sometimes more. They change, different voices, men and women. Some angry, some just whispering. It happens most days now, pretty much all the time.
Okay, so Jason, I would like to ask more about the voices. Do the voices talk about you, or they address you directly?
Both. Sometimes they talk about me like I'm not there, saying I'm being watched. Other times, names, they say my name, telling me what I should or shouldn't do. It's direct, right in my ear.
Okay, what about the content of the voices? Most of the time, are they friendly voices or are they saying good or bad things about you?
Mostly bad things, threats, insults. Sometimes they say I can't trust anyone. They tell me people are out to get me. Hardly ever anything good.
Oh, okay, okay. I'm really sorry to hear that. Have did these
It's just how
voices
it
ever
is now, isn't it? Nobody believes me.
ask?
That's the worst part.
Yeah, it's okay, Jason. Now we are here to help you. Okay, okay.
That's what they all say, but
Did
then
these
nothing
voices?
changes. I just want some peace, just quiet for
Oh,
once.
okay, okay. We will help you. Just okay. We want to understand the problem, and then we can help you. Okay.
You can try, but I don't think anyone really understands what it's like. It's not just in my head.
Okay. Okay. Jason, have these voices ever ask you to do something?
Yeah, sometimes they tell me to leave, not trust people. Once they said to hide, not let anyone find me.
Okay. Have these voices ever told you to harm yourself or harm others?
Sometimes they say things like that. Yeah, they say nobody cares or that people are against me. Makes me feel like I should just disappear, but I haven't done anything.
Okay. So what's your response to these voices? Have you ever act upon these voices?
I try not to. I mostly just leave or hide, try to block them out.
Okay.
But it gets hard when they're really loud. I just want them gone.
Yeah, it sounds very hard, but it's good that you don't respond to these voices. Okay. So for how long have you been hearing these voices?
A while now, months, maybe longer. It's hard to remember exactly. Time gets mixed up when it's like this.
One month. Okay. And how often these voices? How often do you hear these voices?
Almost every day now. Sometimes all day, sometimes just at night. They never really leave me alone.
Okay. Have these voices become worse with time, better, or the same?
Worse, much worse. Louder, more often. Harder to ignore. I barely get any peace anymore.
Okay. Okay, I understand that. I would like to ask Jason, have you ever used any illicit substances or alcohol?
I smoke a bit, yeah. Skunk mostly. It helps me calm down, quiets things sometimes. I don't see the problem with it. Everyone does it.
Okay. What do you smoke exactly?
Just weed, strong stuff, skunk. Helps me chill out at least for a bit, but lately nothing really helps.
Okay. Okay. So, can you tell me for how long did you start using the cannabis, the weed? Sorry.
A few years now. Started just to relax, but then I needed it more, especially when the voices started getting bad.
Okay. Did you say 3 years?
Aye, about
Sorry.
that. Maybe a bit more. Hard to remember exactly with everything going on.
Okay. And what about the voices? Did you start hearing the voices before or after using or while using?
After.
Okay, after use the weed. Okay, I understand. And how frequently use the weed
Most days, really.
per
Sometimes
day?
it's all day if I can. It's the only thing that makes it bearable, you know.
Have you ever experienced with withdrawal symptoms, or no. Have you ever tried to cut down using weed?
Tried before, but then the voices get worse. I get shaky, can't sleep, feel on edge all the time. Easier just to keep using.
You cannot sleep after you. Okay. Have you ever experienced withdrawal symptoms when you try to cut down the weight?
Yeah, I get anxious, can't sleep, feel restless. The voices get really bad too, so I always end up going back to it.
Okay, so what's your action when you experience those symptoms?
I just smoke again. It's the only thing that calmed it down, even a little. Otherwise, I can't cope.
Okay. So I would like to ask about the voices. Do you hear these voices when you are using the weed, while you are using the weed, or even if you stop the weed, you also hear the voices?
I hear them no matter what. Weed makes them a bit quieter sometimes, but they never fully go away, even if I stop.
Okay, I understand that. Okay, Jason. Do you use anything rather than weed?
No, just weed. Never touched anything else. Don't want to mess with harder stuff.
Okay, so I understand that now you start using weed and you have been hearing voices, and those voices makes you feel anxious. So to calm yourself, you use the weed. Is that right?
Aye, that's it. Weed's the only thing that helps even a bit. Otherwise, it's just too much. Can't stand it.
Okay. Okay, Jason. Have you ever experienced okay. Have you ever experienced hearing these voices before this time? I mean, in the past?
No, not like this. It all started after I started using skunk. Before that, things were normal.
Things were normal. So when you start using the weed, then you hear the voices. Okay, that's understandable. Is there anything else bothering you beside the voices?
Yeah, the feeling that people are watching me, following me. I can't trust anyone. Shadows out the corner of my eye. It's not just the voices, it's everything.
Okay. Can you tell me more about those people that you feel that they are watching you?
I don't know who they are, just know they're there. Sometimes outside my window, sometimes following when I'm out. I see shadows, feel like I'm being watched all the time.
Okay, I understand that. So what was your action toward those people watching you?
I try to avoid them, keep curtains closed, don't answer the door. Sometimes I leave the flat, walk for hours just to get away.
Okay, I understand that. Okay. Jason, I would like to ask you about your, is there any family history of similar condition?
Not that I know of. My family doesn't really talk to me anymore, so I don't know if they've had anything like this.
They don't talk to you anymore. What happened? Can I ask?
No, we had some arguments. They said I was acting strange. Stop calling. I haven't seen them in age.
Okay, I understand that. Okay. And is there any history of psychiatric illnesses in your family or substance use?
Not that I know of. Nobody ever talked about stuff like that. I think my dad drank a bit, but nothing like what I'm dealing with.
I understand that. Have you ever been? Have you ever went to a psychiatrist before?
No, never. Never needed to before all this started. Didn't trust them anyway. They just want to lock you up.
Okay, so this is your first time. Okay. Okay. Do you have any I would like to ask more about the weed. When did you start exactly?
What about it? I already
Can you tell me?
started a few years ago, maybe 3 or 4. Just wanted to chill at first. Things got worse after that.
I'm sorry, I didn't understand what you have said. Can you please repeat?
I started smoking weed about 3 or 4 years ago. At first, it was just to help me relax, but then things got worse, especially when the voices started.
Oh, okay. So before using the weed, you said that they help you to relax. Could you tell me more about what happened before using the weed?
Before weed, things were normal. No voices, no feeling watched, just regular stress, nothing like this. Started smoking to chill, but then everything changed.
Oh, okay. So was there any like severe or anxiety or irritability or something like this?
Just normal stress, nothing major. Didn't feel like this. Paranoid,
Oh,
anxious all the
okay.
time. That only started after the voices.
Okay. And okay, I understand that. Did you notice any changes in your mood recently?
Yeah, I get angry quicker. Feel down a lot, hopeless. Moods all over the place now, not like before.
Okay. And what about your sleep?
Sleep's rubbish. Takes ages to fall asleep, keep waking up. Voices keep me up most nights. Never feel rested.
Okay, I'm really sorry for hearing that. Okay. Um,
It's just
okay.
how it is now.
Have you ever tried any? Okay. I'm so sorry to hear that. Have you ever tried to use any medications?
No, never tried any meds. Don't
To
trust them.
relieve your
Afraid they'd
symptoms?
make things worse or mess with my head more.
Okay, you don't trust medications. Uh, do you have any chronic illnesses like hypertension or diabetes? Any heart problems?
No, nothing like that. I don't have any physical health problems, just this stuff in my head.
Okay. Okay.
We'll be done soon. I'm tired of all
I would
these
like to
questions.
ask, yes, I have question. Okay, are you living alone or
Fine,
with
just
someone?
I live
I would
alone.
like to
No
know
one
more
else
about
there.
your
Safer that way. Less people.
environment. Okay. Mm, mm. Okay.
Yeah, well, people just make things worse, easier on my own.
Okay. So, what about, do you have a job recently?
No job. Been on universal credit for a while now. Can't work with all this going on.
Okay. Okay.
Yeah, just can't.
What about, So,
What
I'm
about what?
sorry,
Just ask.
I didn't catch up what you said. Are you working now recently or not?
No, I'm not working. I haven't worked in ages. Can't focus with the voices and everything else going on.
Okay, I understand that. Are you married?
But who? I don't know what you mean. I don't see people much these days, if that's what you're asking.
No, I would like to explore the effect of these voices on your life, like your relationships, your job. Does the voices affect your relationships or your work?
Yeah, it affects everything. Can't keep friends, family, stop talking. Can't hold down a job. Voices just mess everything up. Hard to trust anyone.
Okay. Sorry to hear that. Okay.
Not your fault, just how
What
things are for me
about
now. Are you still there?
okay. Yes, I'm still there. I would like to ask about have you ever been accused
Accused of what? I haven't done anything wrong. People always think I'm up to something, but it's not true.
accused? Yeah, I mean that accused like you, for example, harm someone.
No, never. I wouldn't hurt anyone. People
Or-
might think I'm dangerous, but I just want to be left alone.
Yes, yeah, I understand that. Okay. So
الكيس
Jason.
وقفت. That was 20 minutes.
Okay. طيب.
طيب انت what do you feel went well?
طيب. The assessment of hearing voices. Focus history.
هو this is a full interview لكن هم كان الفوكس is it on the voices ولا كان على شنو هو؟
على الفويسز وعلى البرسكيتوري صح، ما سألت عن البرسكيتوري ديلوجنز برضو.
اوكي لكن الفوكس اللي كان طالب مني كان على شنو بالضبط؟
الفوكس كان اني اشوف البرزنتنج كومبلين وانه هو قبض بالبوليس او حاجه زي دي، انا بس مركز في الحته دي صراحه، وانه كان بيستعمل كنابس.
لا الريكوست في الاول في البري بريف في السيميوليشن ذاته قبل كان طالب منك الفوكس على شنو؟ هي ذاك 20 minutes للفول ايفالويشن لكن في حبه فوكس معين.
ايوه. كان طيب دقيقه بس.
كان على الريسك اسسمنت.
risk assessment.
اي طيب what do you think did not go well؟
صراحة في language barrier أو في misunderstanding، لأنه هو بعض الأجوبة بجاوبها أنا ما كنت فاهم بقول في شنو، اضطر إني أعيده مرة ثانية عشان ما فهمت قال شنو بصراحة، فأخذت زمن في الحتة.
السكانك اللي بيتكلم عليه ده الويد ذاته شنو الماريجوانا ذاته بيكون هنا ريحتها زي اسمه شنو هو الزربان ده السكانك بيكون حاجه معفنه كده فهم بيسموه سكانك. It's a strong marijuana.
Okay.
What do you think could have improved?
I feel a risk assessment حاسة إني ما ظبطه.
Okay.
طيب
في حاجات في قبال ما نفس نشوف الهناي الاسسمنت والهناي الايفالويشن لما يكون عندك مثلا انكاونتر زي دي وبعدين ان شاء الله في الاسابيع الجايه العيان يبتدي يتكلم ما تقاطعه. That's not يعني تدي فرصه يكمل كلامه ما تنط عليه في نص الكلام تقاطعه because it happens several times. دائما دي بتكون مثلا ما it's not a good sign for good evaluation لو قاطعت العيان. تاني حاجة لما انت you're trying to show some sympathy مع العيان ما تقول له I understand you معلش عادي ممكن يديك هنا ريسبونس هنا ده عادي كده هنا ده في برا بتقول له I understand you بيقول لك لا you don't understand me انت ما عشان to understand me يقول لك يعني يقول له this sounds scary كويس it sounds يعني this sounds horrible it sounds scary يعني this like I mean this sounds like very unsettling يعني انت you're taking his experience we're reflecting on it لكن ما نقول له I understand you. كويس نفتح الاسسمنت اداكي باس انا حقرا بريفلي we focus in our discussion. The doctor demonstrates structured and comprehensive approach to psychiatric history and risk assessment of Jason Dodd, effectively covering majority of key domains. There were some strong elicitation of the presenting complaint, detailed exploration of psychotic symptoms, and clear link established between cannabis use and onset of symptoms. The doctor also addressed social, occupational, and functional impacts of the illness, which is essential in the context of police detention. The risk assessment was generally thorough, with direct questioning around the risks to self and others. However, further probing regarding risk from others and self-neglect would strengthen the assessment. Communication was empathetic and patient-centered, although occasional language barriers and repetition were noted. كان في كمية من الأسئلة بتسألوا كم مرة نفس السؤال. The doctor was responsive to the patient distress and validated his experience, which is a key strength for further improvement. More explicit exploration of safeguarding, self-neglect, and clearer summary of signposting of the end at the end of consultation could enhance both patient safety and overall structure to the assessment. Identifying key issues and priorities. Okay, انتي عملتي already, you covered this. Assigning historical context. طيب, you did well هنا. However, while the history was generally thorough, some areas such as specifics of self-care and prior episodes of similar symptoms could have been more deeply probed. A recitation of presenting issues and details. You've done it هنا. طيب, conducting risk and safety assessment. The user also asked about the content of the voices. لكن ما قال لك هنا حبة details was هنا. However, the risk from others, safeguarding, abuse, and the risk for self-neglect were less directly addressed and could improve by asking examples like, are you able to take care of yourself at home? Has anyone hurt or threatened you? Evaluating physical health and wider perspective, the doctor inquired about physical health by asking, do you have any chronic illness like hypertension? طيب. كده move on. Gathering psychological support, environmental information. There was a strong coverage. طيب. Communication, consultation structure and management. The consultation was logical in structure. However, at times the questioning was repetitive and disjointed, and the ending could have been more structured with a summary of the safety netting. Consultation style. Guarantee was you're empathetic and patient-centered, demonstrate repeated reassurance and validation. كويس. Attitude and behavior. Maintain the compassionate and non-judgmental attitude throughout. طيب. Listening skills. Doctor responded. طيب. At times, however, the doctor repeated questionings or sought clarification, which might have disrupted the report slightly. Questioning style. قال لك clear and relevant. طيب. And language use was mostly straightforward and empathetic, but there were occasional grammatical errors and unclear phrasings. لكن overall you did well. أنا هوقف هنا عشان أنا المفروض أوقف ذاته. أشوف دكتور عبد الغني إذا عنده أي كومنت.
شكرا ياسر وشكرا للترينيز اللي قدموا. I think we are getting better and better. هو فعلا الاكسنت بتاعت البيشنت الاخير ده كانت صعبه شويه نو داوت. عشان كده اخرت الريسك اسسمنت ما كانت كومبليت. وفيري امبورتنت انه دائما نشوف التاسك، نحن نركز على التاسك من الاول. يعني الزول مرات يبتدي وينسى التاسك المطلوبه، ودي حصلت كثير حتى في الاكزام يعني. وفي الاوسكي يكون في تاسك محدده، لكن تلقى الكانديديت ديفييتد وماشي يسال عن حاجات ثانيه ما مطلوبه. فشكرا دكتور ياسر على taking over. This is the last session of شهر سبتمبر باذن الله. Next week we start ال 4 sessions بتاعت اكتوبر then نوفمبر لحد اخر السنه ان شاء الله. Thank you so much دكتور ياسر. اخرناك زياده الليله، انت المفروض كان تخلص قبل فتره كده.
ما في مشاكل. العفو دكتور عبد الغني، وشكرا للناس اللي قدمت. وافتكر كل ما الناس تقدم شايف في امبروفمنت حاصل مره ورا مره ورا مره.
بالتاكيد.
شايفه اللي في كميه من الكومنت جات في الاول على الناس ما متعودين يعملوا دايركت انترفيو مع العيان ذاته. دائما they gather information من الكولاترال، من الانفورمنت، من الاهل العيانين. كنت قلت لهم ده المفروض ما يحصل. احنا we should gather always the information من العيان and we complete the rest of the assessment من الاهل. لكن الليل العيان قال لك كلام خارم بارم، قال لك هيستوري ناقص، قال لك كلام انت ما متفق معاه، it is still relevant. وبعدين تكملوا من الاهل.
يس، وده اللي بيحصل والله، لانه حتى يعني انت عارف السودانيز كلتشر، يعني يجوا العيان ومعاهم الكوبيشنز هم ذاتهم اللي بيتصدروا الموقف، وهم اللي بيحكوا اي حاجه، والعيان ممكن يكون ساكت. ونحن as professionals we should not allow this. نقول لهم جدا حنستمع لكم ان شاء الله، لكن هو الزول المعني بالامر الفلاني الفلاني ده خلينا نستمع له في الاول. وحتى دائما انا بطلب من العيان لو عايز يتكلم لوحده ولا في حضورهم. اغلب العيانين يقول لك عايز اتكلم لوحدي، واطلعهم برا وبيتكلم مع العيان لوحده حتى بعد كده ندخله. ف this is very important point اللي قلتها يا دكتور ياسر. شكرا لك وشكرا لجميع الحضور.
شكرا الاسبوع الجاي ان شاء الله. يلا في امان الله.
العافيه، شكرا، جود نايت.
شكرا جزيلا.
شكرا. ستوب شير هنا والستوب الريكوردينج، ونشوفكم الاسبوع الجاي. وين؟
ثانك يو.
شكرا.